On y va? Bonjour à tous et toutes. Good morning. I'm Anne Lagacé-Dowson. I'm the communications person with the Canadian Health Coalition, la Coalition canadienne de la santé, a pan-Canadian coalition of frontline health workers, unions, civil society groups, provincial and territorial health coalitions, researchers, and individuals committed to the protection and advancement of healthcare. Je vais animer cette conférence de presse qui sera assez courte. Steve Staples, notre directeur des politiques, va prendre la parole, et la docteure Melanie Bechard des Canadian Doctors for Medicare. Et nous avons un message amical pour le Premier ministre. The PM was on the Stephen Colbert show in September and said to an adoring crowd that the U.S. needs universal health care, which is of course true. And we are here to remind him and his Prime Minister and his office that healthcare here needs protection from for-profit providers and insurance companies. So I'm first going to open the floor to Dr. Melanie Bechard, but I just want to mention that the Canadian Federation of Nurses Unions, which represents over 200,000 nurses and nursing students across Canada, is also in agreement with our position today. Unfortunately, their president, Linda Silas, who's from New Brunswick, couldn't be with us, but they have endorsed the position that you're going to hear today as well. So I'm going to invite Dr. Melanie Bechard, who is an emergency room pediatrician here in Ottawa and the head of Canadian Doctors for Medicare, to speak now.
Good morning. I'm Dr. Melanie Bechard, and I'm a pediatric emergency physician here in Ottawa. I also currently serve as chair of Canadian Doctors for Medicare, an organization of physicians from across Canada who care about protecting and improving publicly funded health care. But I'm here today because I am worried that even in our country with universal health care, some of my patients have to pay for access and many more cannot afford it. Meanwhile, the federal government has proposed a viable solution, but we've been waiting over a year and a half for them to implement it. My colleagues and I were thrilled when, way back in March of 2023, the health minister at the time, Jean-Yves Duclos, announced that he would issue an interpretation letter to clarify the Canada Health Act. Specifically, he stated that the letter would stipulate public funding for nurse practitioner-delivered care and virtual care. The Canada Health Act was first issued back in 1984 when virtual care and nurse practitioners did not have as prominent a role in the healthcare system as they do today. As such, the provinces and territories have dragged their feet on covering these medically necessary services. Depending on the province, there is limited funding for virtual or nurse practitioner care in very specific circumstances only. This gap has resulted in for-profit corporations charging patients for access to virtual care. Similarly, we have seen even here in Ottawa, for-profit corporations setting up nurse practitioner-led clinics that will provide primary care to patients for a fee. Right now, there are an estimated 6.5 million people in Canada without a regular primary care provider. People are understandably desperate, and we cannot blame them for paying for care when they have so few other options available. We have built primary care as a foundation of our healthcare system. It is extremely difficult to access essential services like vaccinations or cancer screening without a primary care provider. You generally cannot access care from other medical specialists like dermatologists, orthopedic surgeons, or oncologists without a referral from a primary care provider. Even as someone who exclusively practices in the emergency department, I wholeheartedly believe that primary care providers are the bedrock of our healthcare system, and without them, the whole thing comes crumbling down. Structuring our healthcare system this way was not a mistake. Primary care has unique, proven benefits for patients' health. Research evidence shows that continuity of care, meaning that you have a regular primary care provider who knows you and your health issues, reduces the risk of emergency department visits, hospitalizations, and even death. When you consider that the average primary care physician visit costs our system about $54, and the average hospitalization costs our system about $6,000, it's easy to see how robust access to primary care can also save our system money. Furthermore, primary care also reduces disparities in population health. It reduces the gap between the healthiest and sickest people within our society, meaning that it most benefits those who are most in need. If having a family doctor or primary care provider were a pill, I would prescribe it to every single one of the patients that I see in the emergency department. Expanding access to primary care through public funding of nurse practitioners would be a boon to our system, and I am perplexed and frustrated as to why the Prime Minister's office has not made this a priority. Similarly, virtual care has become an essential part of our healthcare system. Since the COVID-19 pandemic, virtual care has become widely used and is consistently rated highly amongst both patients and healthcare providers. It also has cost-saving potential. A study of my own hospital's virtual pediatric emergency service during the pandemic saved our system an estimated $890,000 during its 18 months of operation. In a country that highly values our universal healthcare system, there's no way to justify charging patients for what has become an essential mode of healthcare delivery. We at Canadian Doctors for Medicare fully recognize that there are no easy fixes to the woes facing our healthcare system, but it's important to realize that better is always possible. Public funding for virtual care and expanding access to team-based primary care are relatively low-hanging fruit that are in line with what exists in high-performing healthcare systems around the world. Another quick fix, of course, is to release the Canada Health Act interpretation letter, clarifying that virtual care and nurse practitioner care are medically necessary services that must be publicly funded and not privately paid for. We know that those with for-profit, business-driven interests, including insurance companies, healthcare corporations, and chambers of commerce, are campaigning hard for the status quo. But we cannot tolerate a descent into two-tiered healthcare, where those who can afford to receive access to care are able to gather it, and others are forced to wait. Prime Minister, if you are going to boast about Canadian Medicare abroad, you need to defend it at home. I urge you to work with the Minister of Health to immediately release our long and awaited Canada Health Act interpretation letter. There is already too much waiting in Canadian healthcare. Thank you.
Hear, hear.
Thank you, Dr. Bechard. Thank you, Anne. Good morning. My name is Stephen Staples. I'm the National Director of Policy and Advocacy for the Canadian Health Coalition. We comprise citizens, frontline workers unions, community groups, students, and experts who share a commitment to preserve and expand our public health care system. Today we join with Canadian Doctors for Medicare, thank you for inviting us, and Canadian Federation of Nurses Unions in urging Prime Minister Trudeau and Health Minister Holland to work with provinces to expand Medicare and cover medical services provided through virtual care and by nurse practitioners. As technology and new approaches evolve to provide essential healthcare services, we need to guarantee that the Canada Health Act is respected and followed. Since its adoption in 1984, as Dr. Bechard described, the Act has guided the way to create a national, universal public health care system that provides essential medical care based on your medical need, not on your ability to pay. The increased frequency of patient charges for medically necessary services delivered through virtual care or by nurse practitioners erodes our universal system and threatens to give unfair, preferential access to the wealthy privileged at the expense of everybody else. Health Canada officials have described it as a game of whack-a-mole as private sector tries to pry open the gaps of the legislation to pad their profit lines, especially through virtual care. We've seen this pattern before, with patient charges being levied at private for-profit clinics and for diagnostic services. 3 letters of interpretation of the Canada Health Act have been issued by health ministers since 1984, and in March 2023, as Dr. Bechard mentioned, the Liberal minister at the time announced that a new letter would be issued. So where is it? Where is it? 18 months have passed since the government promised that, quote, no matter where in the country Canadians live or how they receive medically necessary care, they must be able to access these services without having to pay out of pocket. So why has the Prime Minister failed to work with Health Minister Holland to protect patients from unfair charges by for-profit corporations delivering virtual care or nurse practitioners who have been given additional scope to practice but little public funding to do so? Let me venture a guess. Is the Liberal government stalling because big business, telecom giants, and insurance corporations are lobbying to prevent the government from doing as it promised to protect patients? We can't wait any longer. Patients want action, and even the provinces are asking for clarity, as we've seen in the letter from Ontario to the Health Minister, asking for this interpretation letter. Public health care can innovate, whether it's through virtual care or nurse practitioners, while respecting the crucial principles of the Canada Health Act. It's time for the Prime Minister to take action to protect people from prohibited patient charges while accessing medically necessary health care. Merci beaucoup.
Donc, merci. Ceci est la fin de notre conférence de presse. Je remercie Dr. Melanie Bechard, pédiatre et émergentologue ici à Ottawa, et Steve Staples, directeur des politiques de la Coalition canadienne de la santé. And once again, I would just reiterate, where's the letter? Where's the clarity? We really need that from the Health Minister and the Office of the Prime Minister. Thank you very much to everyone, and thank you very much to the staff of the Press Gallery.
And if you have a question online, please use the raise hand function now. Si vous avez une question en ligne, s'il vous plaît, utilisez la fonction lever la main.